Hello everyone, I'm Tan Siao Hui from Group 29. Today I'm going to talk about testing stool of the occult blood. The facial occult blood test (FOBT) is a lab test used to check the stool samples for the hidden blood. So occult blood in the stool may indicate the colon cancer in the colon or rectum. Typically, colored blood is passed in such small amount that it can be detected only through the chemical uses in the fetal occult blood test. So, if a blood is detected through FOBT, the additional tests may be needed to determine the sources of the bleeding. So the FOBT test, it isn't recommended if you have a colon cancer symptoms. If you have noticed that the blood is in your stool, in the toilet, if you have experience with an abdominal pain or a change in your bowel habits, so please make an appointment with your doctor and you can get to know more about your symptoms and can get the treatment earlier. So before doing the FOBT, some doctor may ask you to avoid certain foods or medicine because variant food, dietary supplements and medication can affect the result of some FOBT, either indicating that the blood is present but when it isn't, so it will occur then the false positive or missing the presence of the blood that actually there a false negative. So to ensure the accurate test result, you must follow the instructions of your doctor carefully. For about 3 days before the test, your doctor may ask you to avoid the certain fruits and vegetables, including broccoli and the red meat and vitamin C supplement or a pain reliever such as aspirin and ibuprofen. You collect a stool sample from each of 2 or 3 bowel movements in a clean container, usually taken on consecutive days, and then use an applicator stick to apply a smear of stool to a specific area of card. After the card samples are dry, you return them to your doctor or a designer lab by mail or in person. Your doctor will review the results of the FOBT and then share the results with you. So when you have a negative result, so a FOBT is considered as negative if there are no blood detected in your stool samples, if you have an average risk of colon cancer, so your doctor may recommend repeating this test yearly. If you have a positive result, a FOBT is considered positive if your blood is detected in your stool samples, so you may need some additional tests such as colonoscopy to locate the source of the bleeding. That's all for my presentation. Thank you for listening. Goodbye.